Okay, when you are administering an insulin, you first need to make sure that you have all the required instruments that are needed to administer the insulin. The requirements are: you should have alcohol swab, which you are going to clean the area. You should have a needle for the insulin pen, and you also have the insulin injection, and make sure that you have enough units to administer the required dose. Now, if you're using the insulin for the first time, then you first need to see the cloudiness. If the insulin is mixed, you first need to observe the cloudiness here. If there is a cloudy insulin, then you first need to mix it up by rolling it up like this, or by rolling it up like that gently, or you can do back and forth slightly and gently, so that it mixes all the parts of the insulin. So once you do that, you first need to see this is the prerequisite for the insulins which are mixed. And then after you have done this, you first need to remove the if there is a bubble present in the calibration unit. So in order to make sure, you first need to mount this insulin syringe, insulin needle. Once you mount the insulin needle, you can load 2 units by rotating this dialer. After you rotate this for 2 units, you just press it up in order to make sure that the insulin is coming out. You first need to remove this cap in order to make sure that the insulin is coming out, so that there are no bubbles present in it. So once you prime your device, you are ready to administer. First, you will do the loading. Here you load the required insulin unit, 2, 4, 8, whatever it is required. After you load the insulin, you first need to inspect the site. The good sites are from the abdomen, and the abdomen you can divide the parts into 4, maybe 2 finger breadths away, and it should be upper, lower, into the 4 quadrants maybe, and it should be 2 finger breadth away from the belly button, or you can move it on laterally where it's accessible. So these are the insulin sites. You also need to examine your insulin sites for lipodystrophies, so that when you are administering the insulin, you should make sure that there are no lipodystrophies present on the insulin site. So once you're clear that you're going to administer the insulin in a required place, what you will do is you will load the required insulin unit. You can hold it like this, so that you can insert it in a perpendicular way, and you can administer the required insulin unit by pressing this. Or what you can do is you can put it like this, hold it like this, you insert it in a perpendicular way to the insulin site injection, or you can use another hand to administer the required insulin dose. So once you're done, you press it, hold it for 1-2 seconds, so that all the insulin administration is done. After you've done it, you first need to remove the insulin, and the insulin dose is administered now. While you're administering the insulin to the injection site, you can even hold a pinch of skin or subcutaneous tissue or fat to insert into the area, or you can insert it as it is. Once you're done with it, you first need to cap the needle up, remove the cap, remove the insulin, and then you can place it on a cool and dry place. Assalamu alaikum.